Okay, so why don't we get started? Good afternoon, everyone, and thank you so much for joining us. I'm Dr. Sandra Lowe, Medical Director of the World Trade Center Mental Health Program here at Mount Sinai, and it is my privilege to welcome you to the first session of our three-part series on cognitive health. And I am very pleased to introduce you to my colleague, Dr. Esther McBirney-Goc, who's the Assistant Director of Psychology at our program. And she brings extensive experience in cognitive health and also works directly with 9/11 responders. At the end of the presentation, we will have time for questions. I hope that you will um, have some questions that we can answer. Please type them into the Q&A that you'll find at the bottom of the screen, and we'll be able to address them at the end. So let's begin by taking a look at what this series is going to cover. When we were developing this series, our goal was really to focus on concerns specific to 9/11 responders. For example, over the years, many of you have shared worries about difficulty remembering or concentrating, often asking whether these changes might be linked to illnesses or stress or maybe other factors. And this series was designed in response to your concerns. So in today's session, we'll take a look at physical health conditions, things like sleep apnea, high blood pressure, asthma, pulmonary illness, and see how these conditions can affect how well your brain functions. In future sessions, the next one is in 2 weeks, we'll explore how stress and emotional well-being and lifestyle habits like sleep, physical activity, and diet and nutrition all play a role in cognitive health. We'll share what we know about how all of these factors interact, and most importantly, we're going to offer you some practical strategies that you can apply to support your brain health and help you put some goals into action. We also are going to offer you some suggestions about communicating with your medical team about your concerns, because that is another critical aspect of being able to take care of your health. Now, let's take a closer look at what we mean by cognitive health and why it matters. So, when we talk about cognitive health, we're referring to our brain's ability to remember, to focus, to reason and problem solve, to be able to make decisions. And these abilities are, of course, essential for managing daily life, keeping appointments, handling your finances, and also staying socially engaged, staying involved in activities. Now, changes in memory can occur for many reasons. They can occur due to certain medical conditions or potentially a side effect to some medications. Poor sleep is a big factor in your memory, stress, and inevitably getting old. The good news is there are steps that you can take to manage and in some cases even improve any cognitive difficulties that you may be experiencing. And that's what this series is all about, helping you understand the factors that affect your brain health and for us to share some practical tools to help support you. So now I am going to turn it over to Dr. McBirney-Goc, who will speak in more depth about what cognitive functioning is.
Thank you, Dr. Lowe, and thank you for everyone who's here this afternoon. I'm excited to get to spend this time together. Over the next few minutes, we're going to review some basic information about mild cognitive impairment, as well as different domains of cognitive functioning. So there are many different domains of cognitive functioning, and understanding some commonly used terms can help us better identify where we are struggling and where we continue to function well. It's normal for everyone to have some strengths and weaknesses in these domains, and it's normal for some abilities to shift with age. As I describe some of these terms, I want different members to think through which are working well for you and which may have become more challenging. So when we talk about short-term memory, we're talking about the ability to hold and access a small amount of information in mind for a short period of time. So for example, if somebody tells you their phone number for the first time and you're able to briefly remember it just long enough to grab a pencil and paper and write that phone number down, you're using your short-term memory. And after that, you probably don't need to have that number in your head anymore. You just needed short-term memory to sort of get it from point A to point B. Long-term memory refers to the ability to store information over a longer period of time. There are many types of long-term memory, so I'm going to oversimplify a little bit. But one example is if you know somebody's phone number by heart. So even though they told it to you years ago, you still are able to pull that information up. That's an example of long-term memory. Another example could be remembering the details of a conversation that you had a week ago. Now, sometimes we think about problems with long-term memory, and there can be a couple different things that are impacting our ability to pull out older information. So some people may have trouble putting the information into their long-term memory in the first place. We sometimes call that encoding. And others may have difficulty accessing the information that's there. So the information actually is somewhere stored in your brain, but you're having trouble pulling it out at the time when you need it. So for example, this is a common one that I hear often. Let's say that you go to the grocery store and you're thinking through all the things that you need, you make your purchases, you check out, go home, and your significant other says, "Where's the milk? It looks like you didn't get the milk." Now, if you have that, "Oh no, I forgot" moment, that moment of, "Oh yes, we did discuss that. I did know that we need milk, but I couldn't remember that in the store." It sounds like that information actually did get into your long-term memory, but you had trouble retrieving it. You had trouble pulling it out when you needed it. But if your significant other says, "Oh, where's the milk? We discussed that we needed milk," and you have no recollection of the fact that you were out of milk or that conversation, then it might be that the information never really got encoded. It didn't get properly stored in the first place, and that's why you couldn't pull it out when you needed it. And kind of narrowing in where the problem is can help you figure out how to cope with the problem better. Now, when we're talking about attention, we're talking about that ability to sustain focus, filter out extraneous information or distractions if needed. For example, if right now, as I'm speaking, your mind is drifting off to the many other important things you have going on in your life, you're probably not fully attending to what I'm saying, and therefore, all the information I'm giving you isn't going to be able to successfully get into your memory. So it's not necessarily that you can't recall something that was previously stored in your memory. It's that it was never fully entered in the first place because your attention may have been elsewhere. Not paying attention does not necessarily mean a lack of interest, but it can really be heavily influenced by mental health symptoms. So, for example, if you're very anxious and worried about something, it makes it difficult to pay attention to what's happening in the present moment. Lastly, to talk a little bit about, people may have heard the term executive functioning. This is referring to our ability to think flexibly, manipulate information in our minds, and use inhibition and self-control. It's very important for things like multitasking, switching between tasks without getting derailed or confused. Another thing I'll often hear from people is that they're frustrated because they used to be excellent multitaskers, and now they find that when they're trying to shift between different responsibilities, they get derailed and they really have to focus more on doing one thing at a time. So by reflecting on our strengths and weaknesses in our memory and attention, we can be more specific in where we struggle. So instead of just saying, "I have a bad memory," we can really get into a little more detail about what's working and what isn't working for us. And that can help us identify where we may need extra help and what strengths of ours we can capitalize on. So thinking through the questions on this slide can help us identify which of our strengths can help us, which weaknesses we may need to help find coping strategies for. And it can also help us be more specific when discussing our cognitive difficulties with our medical providers. I'm going to read through these questions. And if you have something to write with, I encourage people to jot down, what comes to mind about these questions for yourselves. These notes are just for you. It's really to start help you flesh out your understanding of your own strengths and weaknesses in cognition. So to go through these questions, I want people to think about, when do you have difficulties with memory? Are there certain contexts or times or scenarios where you notice that your memory is worse? Maybe it's times when you're very anxious. Maybe it's when you're in a big group gathering. Really think through, when do you notice the problems the most? Next, think through, are there tasks for you that are more challenging than they used to be? In particular, think about things that you used to be able to manage fairly well, and now you're noticing they're a bit of a struggle. Make note if you have family or friends who've commented on your memory. This can be really helpful because sometimes our family and friends notice things even before we do. Make note about what worries you have about your cognitive problems. Are there things that are on your mind that are worrying? And that last question is, when does your memory feel sharp or focused? So it's really easy for us to focus in on what's not working. You also want to think about what is working, because that may be a resource you can really fall back on. That if there are some things that are getting harder, we want to think about, where are your strengths and how can you utilize them? Now, depending on what you jotted down just now, you may decide that you want to share some of these reflections with your care providers so they can better understand your cognitive concerns. The more detail you can give your care providers about your worries, the better feedback or ideas they may have in terms of how to help you. Now, I think people may have heard this term, mild cognitive impairment. It's an important area of research. It's in the news not infrequently. It's a broad term, but it largely refers to a decline in an individual's cognitive abilities beyond normative aging, but not to the extent of interfering with the individual's ability to carry out usual daily activities. So, as Dr. Lowe mentioned, all of our memories will struggle a bit more over time as we get older. But mild cognitive impairment is indicating something that's beyond that, but where we're still able to do most of the things that we need to take care of ourselves and get through our day. Mild cognitive impairment is best thought of as a broad definition. So people with mild cognitive impairment may have different cognitive difficulties and strengths than other individuals who also have mild cognitive impairment. So there's really no one way that this can look. So, for example, one person might find that their ability to process new information is much slower than it used to be, but their ability to recall a list of items to get at the store is still quite strong. Someone else might be able to think quickly, but they have a great deal of difficulty shifting between tasks without getting confused. Many World Trade Center Health Program members have asked, is what I'm noticing part of normal aging, or is it something more? MCI refers to difficulties beyond what you would expect with normative aging. So we're all forgetful at times, and a slight increase in forgetfulness or taking longer to process information is a normal part of aging. MCI is a degree of difficulty beyond these normative changes. So if you have concerns about your cognitive functioning and you discuss these with your provider, they may give you something that's called a cognitive screener to get a better sense of whether your difficulties are closer to what would be expected in normative aging or a sign of greater decline. And while MCI can have many causes, and so the progression of these difficulties varies from person to person. So even if you've been told that you are experiencing mild cognitive impairment, the prognosis for that and what it means isn't the same across individuals. So some people with MCI may experience a worsening in cognition over time. Some might stay stable, and some, if they implement certain changes, may even experience improvements. The recommendations for promoting cognitive health that we're going to make later in this presentation are good for everyone's brain. So whatever the cause of your difficulties, these recommendations can maximize your cognitive abilities. Now, just as there are many pathways to developing mild cognitive impairment, there are many pathways to promoting cognitive health. Our hope is to share some of these today so that members leave with some ideas of what they can do to support the health of their brain and mind. Dr. Lowe will now explore how physical health conditions influence memory and thinking.
Thank you. So physical health and brain function. When we think about brain health, we often focus on memory, concentration, the things that Dr. McBirney-Goc was just discussing. But we don't always connect it to what's happening in our body. The reality is that physical health plays a major role in how the brain functions. And this is especially relevant for many of our program members who are living with multiple chronic health conditions. So let's take a closer look at how some of these health issues may affect your cognitive abilities. These are some of the health conditions that we commonly see among program members. Each of these can affect brain health in different ways, especially if they are not well managed. So, for example, chronic obstructive pulmonary disease, COPD, and other lung conditions can lower the oxygen delivery to the brain. And that in itself is going to result in slower thinking, at times confusion or trouble focusing, depending on the severity of the episode you may be having. High blood pressure is a very common condition. Over time, what it does is it reduces the blood flow to the brain. Importantly, it is one of the most significant risk factors for cognitive decline, and it's also treatable. So please mark that. Many of you are also diagnosed with sleep apnea. It is one of the World Trade Center exposure-related conditions. This condition decreases oxygen level in your sleep, and it also impairs your sleep at night. And it is going to, of course, leave you feeling very foggy and forgetful and sometimes irritable during the day. Likewise, chronic pain, regardless of the cause, can really wear you down. It is very depleting. It drains your ability to focus, to pay attention to things. And it really does impact your cognitive abilities. For those who have been diagnosed with cancer, especially who have undergone chemotherapy, we know that cancer and its treatment can impair cognitive function. It's important to realize that as you're going through treatment. And a lot of this is reversed once the treatment is completed, but it can be very challenging as it's occurring. Now, one of the things that we're learning a lot more about is inflammation. Inflammation results from many conditions, for example, autoimmune disorders, chronic infections, post-traumatic stress disorder, cardiac disease, and inflammation itself is recognized as a really significant contributor to cognitive symptoms of all types. So if you have any of these conditions, be aware that they may be affecting your memory or your focus. So make sure that you are clear on the treatment that you're receiving for this, and make sure that you're following up on recommendations. Now, in addition to chronic illness, medications themselves can have a role in brain health. So let's consider how medications affect your cognitive function. And this can be both positive and negative, starting with the negative. So, first, some medicines can cause side effects that lead to mental fog or forgetfulness. And some common examples include sedating pain relievers, medications used to help with sleep, some antihistamines, and high dose steroids, which sometimes are needed to manage some serious conditions. These effects are often temporary, but they can be more noticeable with long-term conditions, and they can be longer lasting in older adults. Second, combining medications, even vitamins or supplements, keep that in mind, increases the risk of drug interactions. And that's why we strongly recommend that you have a medication review at least yearly. You just need to make sure that you take all of your pill bottles, prescription medications from all of your doctors, over-the-counter medications that you may be taking, herbal supplements or remedies. Um, Bring that bag to your medical visits. Your provider will actually appreciate being able to see the medications and the dosing, and it'll be really helpful to enter that into your chart so that we can all be aware of what you're taking and look for potential interactions. And finally, this is the part that we don't talk about enough. Many medications actually support your brain health. For example, when you use inhalers for asthma, it helps to prevent episodes of low oxygen levels because low oxygen level is going to cloud your thinking. Um, CPAP machines or nasal steroids for sleep apnea improve oxygen levels over the course of the night, and they also improve sleep quality. That's going to significantly help you with focus and alertness. Medications like antidepressants can improve mood, improve energy, and directly improve focus, making it a lot easier to concentrate and remember. The, the takeaway is this. Not all medications negatively affect your brain function. In fact, many are important to supporting your brain health as well as your physical health. Um, when conditions are effectively treated, it often leads to better cognitive function and overall improved quality of life. If you can think clearer, you feel better. So, when you do have concerns about side effects or about interactions, speak with your provider. You don't have to handle this on your own. Don't need to make changes on your own. So now that we've covered how physical health and medications can influence brain function, let's turn back to the key question, and that is, what can you do to protect your brain health? And for that very challenging aspect, I'm going to turn it over to my colleague. So, Dr. McBirney-Goc, can you please walk us through some practical steps that we can all take?
Absolutely. So next, we're going to be covering some ideas of what responders can be doing to care for their brains. Um, I want everyone to give themselves a pat on the back for the things that we mentioned here that you are already doing and keep it up, and jot down ideas of things that you aren't doing yet that you might want to try after this webinar. So as Dr. Lowe discussed, medical problems, particularly if they're not well managed, can worsen cognitive functioning. By regularly attending your monitoring visits and follow-up visits, you can work toward minimizing the impact of medical illness on your brain. If you're behind on your monitoring visits, you should call 212-241-1554 to schedule. Now, even without memory difficulties, it is a very common experience for individuals to forget the questions they have for their providers during the appointment and remember only after they've left. I'm betting a lot of people here can relate to having a doctor ask us if we have any questions or concerns. We say no, and then as soon as we're out of the office, remember something important that we'd actually been wanting to bring up with them for weeks. One way that we can manage this is to always write down a list of questions and concerns before your visit and bring that list with you to the appointment. It can also be helpful to ask a provider to write down instructions for you. This can be especially helpful if you're juggling multiple treatment plans for different medical problems. Having written down notes can really help you keep track of things and stay on top of your care. It's not uncommon for medical appointments to feel stressful, and we know that when we're feeling stressed and anxious, it makes it even harder to absorb all the information that the doctor is providing to us. For some people, it's really helpful to consider bringing a trusted loved one to come and take notes to help you remember the information. Some people want the loved one with them during the visit. Some people say, I'm going to do the checkup and then I'd like to ask the doctor to have my loved one come in at the end when we're having a discussion and take notes. This can be really useful, especially in high stress situations. Lastly, we know many of our members are already making use of My Mount Sinai. If you haven't already, I'd encourage you to sign up for this. It's going to give you regular reminders about, appointments. It's going to give you some written information. And so it really does a lot of the legwork in terms of helping you stay on top of your medical care and follow-up treatment. Following the recommendation on the slide can reduce anxiety about medical visits and managing treatment plans, and it can also strengthen your communication with your treatment providers so that you can get the most out of your care. Next, we really want to encourage everyone to be active in managing your medication and your treatment plan. One of the things that's most important to me is consider your treatment team isn't just your doctors and various providers, but you are the most important member of your treatment team. So you being on top of your treatment plan and in agreement with your treatment plan is going to go a long way. If you're not sure what the treatment recommendations are for your conditions, or you're having trouble following through on the treatment plans for your conditions, this is a really important topic to discuss with your treating provider. Sometimes we'll hear that people are feeling ashamed or hopeless because they can't follow up on the treatment plan, and that gets in the way of discussing with their provider. I'd really encourage you to bring up these concerns with your providers so that they can help you. Take it as an opportunity to identify what is making it difficult to follow through on your treatment plan. Common examples that I hear pretty frequently on what makes it hard to follow through with treatment plans are things like not taking medications as prescribed, either due to forgetfulness or concerns about side effects. Some people describe struggling to make recommended dietary changes. Probably most of us know that we should eat better, but that doesn't make it easy to do. And we'll often hear about people not using CPAP machines as instructed because they're uncomfortable or maybe they're missing a part and they haven't gotten around to getting it fixed. If you're running into any of these barriers, discuss them with your provider. Your provider may have strategies that they can suggest to help remedy the problem. They may have alternatives or other ideas of what's been useful for other patients. If you're having trouble remembering to take your medications as prescribed, you can try things like a pill box or a written medication log or set reminders on your phone. If you're really struggling and you have someone that you trust, like a loved one in your home, it can also be helpful to clue them into your treatment plan and ask for support in following it. So I want to emphasize how important it is to take care of your emotional health. Sometimes mental health symptoms like anxiety, depression, or low motivation can make it harder to manage physical health conditions. So, for example, someone might not get a recommended MRI because of panic attacks that they have in tight spaces. Or it's not uncommon for us to hear about people avoiding attending their World Trade Center medical appointments because they may trigger really upsetting memories. As these examples highlight, Some of the needed behaviors to treat a medical condition can be challenging to implement in real life for a multitude of reasons. If you're feeling anxious, down, or overwhelmed, it's completely understandable that keeping up with medical care might feel even harder. So, the good news is that there's support available to help with these difficulties. And improving your emotional well being can also help you think more clearly and feel more in control. If you're already engaged in mental health treatment, discussing how mental health symptoms are interfering with your treatment plan is important to discuss with your provider. These are very appropriate things to bring up in therapy or bring up with your psychiatrist to say, I'm trying to treat this problem, but I'm noticing that I'm avoiding it because it's making me anxious, or I'm feeling very worried about it, or I'm forgetting to do the things that I need to do. These are things that really can be addressed effectively in mental health treatment. If you're not yet engaged in mental health treatment, you think that you may be having some symptoms, um, you should call 212-241-8462, which is the World Trade Center program's mental health site. And you can request an evaluation where someone will assess you and give you some recommendations on whether mental health treatment might be useful for you and what type of treatment that might look like. Also, to give a plug to the next webinar in this series is on July 30th. And during that time, we're going to be discussing mental health and cognitive functioning in even more depth. So to sort of sum up this piece, our emotional, physical, and cognitive health are interconnected. So when our physical and emotional health are well managed, it supports our ability to think clearly and follow through. It's really hard to treat our physical health without treating our mental health and vice versa. So next, I'm going to turn to some practical questions you can ask your medical providers, taken by Dr. Lowe.
Thank you. So, one of the most valuable steps you can take to support your health is to be able to ask questions, especially when you're noticing any changes. Understanding how your medical condition and its treatment affects you puts you in a better position to manage it. Gives you more control. So, for example, consider asking, could this change in my memory be related to one of my conditions? Is this condition going to result in my memory or my concentration getting worse? Are there things that I can do now to help it from getting worse? Being able to attend to things earlier is generally helpful in minimizing any problems down the road. It's also important to ask specifically about medication. For example, could my concentration problems be related to this medication that I'm taking? What side effects should I watch for? Am I taking this the right way? This is important because even small things like taking a dose at night instead of in the morning, or taking it on an empty stomach or on a full stomach, can really affect how well it works and how it affects your thinking and your recall. Um, Also, make sure that you ask whether it's safe to take this with other medications, supplements, the over-the-counter meds that you may take it. These are just examples of some questions to ask. As Dr. McBirney-Goc mentioned earlier, it's good to have a written list when you come in for your appointment. It makes it a lot easier and it makes it a lot faster to be able to get everything in. I know that sometimes appointments can feel very short. So if you have your questions ready, it'll be really helpful. Keep in mind, you're not supposed to know the answers, but you can know the right questions to ask. So now let's just talk a little bit about how communication with your treatment team can help. So, whether it's starting a new treatment, figuring out how to use an inhaler, that's something that comes up an awful lot, or a nebulizer, um, getting tips or getting tips on remembering to take medications or how to stick with a goal. Having support makes it easier. Having support makes everything easier. And that's when your World Trade Center health team comes in. Our providers, case managers, and the many other health staff that attend to you, we will work together. So when you share your concerns directly, whether it's about memory or how to follow your treatment plan, please tell one of us. It really helps us respond more effectively. Sometimes we don't even realize that there's a problem. And remember, you don't have to manage your care alone. Support is available, and we really encourage you to use it. Now, um, if you're having trouble following through with the plan, um, knowing how to set realistic goals makes a great difference. This is kind of part of the core of the message that we want to convey today. So, Dr. McBirney-Goc, will you help guide us through how to make this problem easier? Because it can be really complicated.
Yes, one of the things that we do here when we provide some of this information to our members is they start to feel overwhelmed. It feels like there's so much to do. It's so high pressure. Most of us care in a very personal way about our memory and our attention that it becomes so overwhelming that people set these big, broad goals that are hard to follow through on, and then nothing happens. And what we want is really to provide a framework that's the opposite of that. We want everyone to feel like there's a whole buffet of things that you could pick from that could help your brain and your attention and your memory. So you want to pick some bite-sized pieces, start with those and go back when you're ready for more, but you don't have to do it all at once. Um, so what I want to do is I want to talk about how some different risk factors can interact to impact our cognitive health. And that can be one of the things that can make setting goals feel really overwhelming when we start to think through and notice all of these interactions. But how, if we look at those interactions in a different way as an opportunity where there's multiple different things that we could try to improve our brain health, that then actually it starts to feel like there's more things we have agency over that feel reasonable for us to tackle. So this is just one example of many of how different risk factors can affect cognition. Because we start to notice that, most people will have more than one risk factor. And then when they start to interact, we start to get a sense of how they might all be reinforcing one another in a problematic way. So, right at the center of this chart, we have poor sleep quality. We know that poor sleep quality, not enough sleep, is a very high risk factor for cognitive difficulties. This is probably pretty relatable to most people that if you have a poor night's sleep, you're a little fuzzy the next day, that you have many months, many years of poor sleep, that it gets even worse. Now, let's imagine that you're somebody, if we look at that top box, let's say you're somebody with a rotating work schedule. So sometimes you're working at night, sometimes you're working in the day. You don't really have a set sleep schedule. We know that's going to lower your quality of sleep, and we know that's going to make you more prone to then having cognitive difficulties. Now, let's say on top of that, you have untreated sleep apnea, so that you're not using your CPAP, or maybe you haven't followed up with a medical visit, so you haven't even, gotten a hold of one yet. We know that's going to impact your brain in a couple different ways. It's going to reduce the quality of your sleep, which we know is going to further lead to cognitive difficulties. We know that not getting enough oxygen to your brain from untreated sleep apnea is going to have additional negative effects on your cognitive functioning. Now, maybe in addition to that, you've got some post-traumatic stress disorder symptoms that you haven't gotten help with. And we know that PTSD worsens sleep. So again, we're lowering our sleep, which can worsen our cognitive functioning. And there are other more direct ways that PTSD can impact our cognitive functioning as well. So when we add all these together, we see that we have this web of things that are likely contributing to us having problems with memory and attention. This is where people can start to feel really overwhelmed. But I want you to look at this slide a little bit differently. Each of these arrows, I want you to think of as a link that you could start targeting. That by targeting any of these arrows, it's likely to have, benefits for your cognitive functioning if you can reduce any of these arrows. But that also by impacting some of these arrows, you could actually loosen up some of the other relationships that are leading to cognitive difficulty. So if we start addressing one, it might actually loosen things up enough that it starts to make it easier to address some of the other problems that we're having. So for example, if we look at the untreated sleep apnea box, let's say that I set a goal of I'm really just going to focus on trying to wear my CPAP machine more regularly. And let's say that starts to lead to me getting better sleep quality. I'm going to feel a little bit more rested. That's also going to be one of the best things I can do for my brain is making sure that I'm getting enough oxygen to it all night. Maybe once I start also getting a little bit better sleep, a little bit better sleep because I'm wearing my CPAP machine, I might feel like I actually have more emotional resources to start addressing my PTSD and treatment. It can be really overwhelming to address mental health symptoms. Maybe if I have a little more sleep, adding on the next goal of treating my PTSD feels a little bit easier. For other people, starting on the other side of this chart might be the right step for them. I've heard people say that wearing the CPAP machine makes them feel a little bit claustrophobic at night, which they very much relate to their PTSD symptoms. So getting into mental health treatment and finding ways to cope with some of those symptoms actually makes it, in addition to the PTSD then having less of an impact on their cognitive functioning, makes it a little easier for them to put that CPAP machine on at night. So I hope the takeaway from this is instead of getting overwhelmed by the multiple risk factors that you may have, think about how addressing one of them might actually start to get the ball rolling to make you feel a little bit more able to address the other ones. So we really want to start with one of these arrows at a time. We don't want to try and do it all because we probably will get overwhelmed, but we really want to start with something manageable and continue from there. So again, just to reiterate, our recommendation is if you're feeling overwhelmed by many different things that you think you may need to change to improve your cognitive functioning, like presented here, focus on making your changes bite-sized. Now that might sound sort of easier said than done, which is why we really like the SMART goal framework. This is a framework that's used to sort of take goals and make them specific, make them feel manageable, and make them more likely that you're going to follow through on them. I think sometimes the members that I see in our mental health program are surprised when they come in with big goals and I ask them to make them smaller. And that's not because I don't want people to achieve the big goal in the long run, but because I know the best way to get there is actually to start with something smaller. So I'm going to walk through what this all means. The SMART goal is an acronym. So the S in SMART goal is we want our goals to be specific, very specifically. What do I want to achieve? We want to try and make it not overly broad. We want our goal to be measurable. How will I know when it is accomplished? Like, what is the checkbox that I would say it's very clear to me that I've done this? I can check it off my list. We want it to be achievable. This means a couple things. One is we want it to be realistic. We don't want it to be so big or overwhelming that it would be hard for us to do. And also, how are we going to achieve it? What sort of strategies or people can we rely on to make sure that we achieve this goal? We want it to be relevant. Does it seem worthwhile to you? It has to be worthwhile to you, not necessarily just worthwhile to your doctor or to your loved ones, but it has to be meaningful to you because that's where the motivation is going to come to follow through on something that might be difficult. And we want it to be time bound. This can mean both, when can I accomplish this goal? Like what is the start time for it? We want to be really specific on that so we don't keep putting it off. But also we want it to have a start and an end time. If we set a goal that's ongoing for forever, it becomes harder to measure. But if we know that we're trying something for the next 2 weeks, then it's easier to know when we're checking it off and we can always extend it again later. So I want to give an example to kind of, zero in on what I really mean there. This is a great goal right here. I will quit smoking sometime soon. We know that not smoking is one of the best things that we can do for our health. It's one of the best things that we can do for our brain because amongst, many other things that when we're smoking, we're reducing our circulation and our ability for our brain to get enough oxygen. So even though this is a wonderful goal, if you're worried about your cognitive health or your health in general, it's very broad. I don't have a sense of how I'm going to do it. If it were so easy for most people to quit smoking, they would just quit smoking, but for many of us it's actually quite a difficult task. So I'm going to take this and I'm going to translate it to something in the SMART goal framework to give people a sense of what that might look like. So I'm going to translate, I will quit smoking sometime soon. Going to make it more specific. I want to get tools to reduce my smoking. I need some tools, I need some strategies to be able to do this. So then the question is, how am I going to get those tools? To make this measurable, I'm going to say I'm going to do it by scheduling a smoking cessation visit. Now, what's nice about this is you can check that off your list. You know when you've called, you know when you've scheduled the visit, you know when you've completed this. We want it to be achievable. So what I have here is I'm going to tell my loved one about this goal for support. So again, part of achievable is figuring out what resources you have at your disposal to make this work. Now, it's not listed here, but another part of what makes this achievable is, again, I'm just going to quit smoking on my own. That's not so achievable, but I'm going to schedule this appointment. That's bite-sized. That's something that we can do more realistically. Relevant. This is going to be good for my physical and cognitive health. Maybe my physical health hasn't been great. Maybe I'm worried about my attention and memory. The relevant piece is me really being explicit with myself about why I should be motivated to do this, even though it's likely going to be hard. Time bound. I'm going to call to schedule an appointment this Monday at 9 a.m. Now, the more specific you can be about the timing, the harder it is to sort of put it off because life is going to happen. You're going to have things get in the way. You might be anxious about doing it, but if you have it in your calendar to do Monday at 9 a.m., it's going to be easier to know if you've actually achieved this goal or if something's getting in the way and you need to troubleshoot it. Now, let's say that you do set the SMART goal and you achieve it. Then you can extend the goal to something else that's associated. Maybe you achieved the goal, you set the smoking cessation visit. Maybe the next SMART goal is attending that visit. Is like, what am I going to do to, make sure that I actually make it to this appointment? What strategies am I going to have so I don't forget it or avoid it? Now, let's say the opposite could be true. Maybe you didn't achieve this SMART goal. This is still not a failure because it gives you a chance to troubleshoot what went wrong and then revise the SMART goal. So, for example, maybe 9 a.m. on Monday came and went. I didn't call to schedule this appointment. And I didn't remember until 6 p.m. that evening, at which point the clinic was closed and I actually couldn't call to schedule it. If I troubleshoot and I say, oh, actually, you know what the issue was? I didn't remember to do this. Then it gives me a chance to revise the goal. Maybe in that achievable category, I want to write down, I'm going to set a very loud reminder on my phone at 9 a.m. on Tuesday so that I can't forget. So anytime you don't achieve a SMART goal, it's not a failure. It's a chance to troubleshoot what went wrong and revise the goal. I'll go through another one. Here's another great goal, but it's too big and broad. So I'm going to be better at following my medical treatment plans. I'm betting that the majority of people here have quite robust treatment plans and that something this vague might feel overwhelming or hard to do. So let's translate this. Let's make it more specific. I'm going to start by taking my medications as prescribed. I bet I have a lot of things on my treatment plan, but I am not taking my medications on time. I'm not taking them with food when I'm supposed to. That's the specific thing I'm going to start by looking at. I want it to be measurable. I'm going to try and do this every day for 2 weeks. I'm not going to try and do this every day forever because then it's hard to tell if I've actually accomplished it or not, but I could track it for 2 weeks and I could always extend it later if I need to. Achievable. How am I going to do this? I'm going to set reminders on my phone so I do not forget. How How is it relevant to me? I'm really concerned about my blood pressure and my COPD. Those are things that are really on my mind. And so that's what's going to motivate me to do this even when it's hard. Lastly, I want it to be time bound. I'm going to start this goal tonight. I'm not going to say I'm going to do it sometime soon. Who knows when sometime soon might be. I want to have a specific date of when I'm going to try this. Now, some thing I want to highlight again is you don't want goals that go on forever because that stops feeling achievable and it's hard to measure and check in with yourself on how you're doing. It's better to have a goal that's small and time limited. And then if you get to the end of that 2 weeks and it worked well, you're going to extend it. If you get to the end of that 2 weeks and it didn't work, you're going to troubleshoot it and figure out what might work better. So, for example, let's say I actually didn't achieve this goal and it's partially because one of my medications is giving me side effects, or I think it's giving me side effects, and just am not motivated to take it because I'm worried I'm going to feel worse. I might troubleshoot that by having a new goal that's actually, I need to have an appointment with my provider to discuss these side effects so that I can come up with a treatment plan that I can actually adhere to. So I'm going to pause here for just a moment as we start to come to the end. I want to give everyone a second to look at the SMART goal framework again. It's also available, widely online if people would like to look there. But take a moment and try to jot down, based on the information we gave you today about potential goals for the future, things that might help your cognitive health. Try your hand at jotting down a SMART goal. So something specific, measurable, achievable, relevant, and time bound that you could try maybe starting in the next week to try and improve your cognitive health. So I'm going to pause there just for a moment to give people a chance to think that through. Now, I know that not everyone may have had time to finish, but hopefully that's given you a chance to make a start on something that might be meaningful for you to try the next week. Dr. Lowe is now going to close us out by sharing what's coming next in the series.
Thank you so much. So before we conclude, I do want to remind you that this webinar is the first in the three-part series on cognitive health. Today we focus on physical health, how medical conditions affect your brain, and steps that you can take to protect your cognitive function. The SMART goal framework is an excellent framework to apply, and we're going to actually mirror that in subsequent sessions because it's applicable to in so many areas. So in our next session, which is in 2 weeks, we're going to take a look at stress and how your emotional health is related to your memory and your cognition. And then 2 weeks after that, our final session in this series, we'll talk about habits, habits that we all know we should be engaging in: physical activity, good sleep habits, good nutrition, and how these all support brain health in the long term. So in the next slide, we have some contact information to share so that if this session raised any questions, or if you would like some help with medical or mental health care, please reach out to your care team. The general contact information is listed here on the slides. Please reach out. We are here to help. Thank you for joining us today. And now we do have a few minutes and we would love to hear from you. So if you have any questions, please place them into the Q&A at the bottom of your screen and we'll be able to address them.
One question that's popping up is if someone's been feeling more forgetful, but I'm not sure if it's from stress, aging, or something else, how do I figure out what's going on?
Do you want to go ahead and take that? Because I think you did address that in some of your slides.
Yes, absolutely. The first thing that I would recommend is bring it up with your providers. Something that can be really helpful to think through is some of us have cognitive weaknesses that we've always had. I for one, am someone where if I don't write things down, it's going to be hard for me to remember. That's been my baseline. So that's not really an evidence of a cognitive decline. That's kind of one of the quirks of my brain. But let's say I used to have a really strong memory and now all of a sudden I have to write everything down. That's a time to kind of flag, like there is a change. Like I can tell from my own personal experience that there's a change. And that's what I'm really trying to tease apart. Is that aging or could that be something else? I think that's a really important time to speak with your providers, your mental health providers, your primary care physicians, whoever it may be that you're seeing, and they'll be able to really talk through what changes you're noticing and help you, clarify whether or not that sounds more like normative aging or a larger problem. And sometimes they can give you a screener, which is an objective measure where they can kind of compare your performance to where other people your age might fall, and again give a better sense of, is this just a part of getting older or might this be an area of concern? But I can certainly add on to that the things that we've recommended here are good for your brain, whether or not your difficulties are from just a normal aging process or something else. Everything we recommended is going to be good for your brain either way.
Another question, quickly, before we end, is I take many medications for a lot of different health conditions. How can I tell which one might be affecting my memory? I think this is a common concern, and it is something that we hear a lot. One of the points that I wanted to make during the presentation is that when there are multiple medications, the potential for interactions or multiplied side effects is much greater. So make sure that your provider knows all of the medications that you're taking. And it's also important for you to be able to ask. Say, I've been on this medication for the past 5 years. Do I still need to be on it? Or are there any alternatives to this medication that might have less of this side effect of making me feel sleepy during the day? Um, or just asking about it is the first step. So I would encourage you to have open communication with your providers, write the questions down, and sometimes it's a matter of just yeah, lowering medication. The dosing might be appropriate in some cases. So there are a lot of ways that it can be approached. Just ask the questions. And with that, our time is up. Thank you very much, everyone, for joining us. Thank you so much, Dr. McBirney-Goc, for your expertise. We hope to see you in 2 weeks for the next episode.